Hello, today I will be presenting information regarding auditory processing disorder, which also goes by the acronym APD. Auditory processing disorder is defined as having difficulties in the perceptual processing of auditory information. The central nervous system plays an important role in our ability to process auditory stimuli and allows us to do many things, such as localize the source of sound and discriminate between multiple sounds. Individuals with APD have difficulty hearing necessary information in a noisy environment and may feel at a disadvantage. For example, a child with APD may experience academic challenges in school if they are unable to hear their teacher when there is a background noise. Another effect of APD is the inability to write letters when a word is verbally said to them. Therefore, this child with APD may be receiving poor marks on spelling exams. Due to this disruption in their auditory system, individuals with this disorder not only have difficulties in listening to auditory information, but also experience difficulties in responding. If they are unable to fully process what is said to them, then they will not be able to produce an appropriate response. As you can imagine, living with this auditory processing disorder is not ideal. Unfortunately, auditory processing disorder has a large prevalence in our society. According to the Auditory Processing Center, approximately 5% of school-age children have some type of auditory processing disorder. Additionally, according to the National Institute of Health, in children with learning difficulties, the prevalence of auditory processing disorder has been found to be 43%. Some of these learning difficulties that accompany auditory processing disorder can include dyslexia and specific language impairment. Auditory processing disorder began to scratch the surface in 1954 with the help of Helmer Michelbust. He expressed the importance of evaluating central auditory function in children he thought were susceptible to communication disorders. The following year, a team of Italian physicians started to enhance tests that better evaluated auditory difficulties. Then, in 1977, research in auditory processing disorder officially sparked the interest of more scholars in the field after Robert Keith's presentation at a conference discussing auditory processing disorder in children. Now that I've presented to you what auditory processing disorder is and provided you all with a brief history, I would now like to discuss the test battery that is involved in evaluating APD. It is important to note that when evaluating APD, it is best to adopt a team approach consisting of the patient's family, an audiologist, a speech-language pathologist, teachers, and other health professionals. Having this well-encompassing approach is in the best interest of the patient. The evaluation begins with obtaining a well-detailed case history. This plays an important role in selecting the best test battery for a given patient. For this hearing disorder, there is not a golden standard. Therefore, having an accurate case history is crucial in selecting the right test battery to utilize when moving forward in the evaluation. A standard audiometric test consisting of pure tone audiometry, tympanometry, and autoacoustic emissions should be conducted in order to evaluate the peripheral system and hearing thresholds. Tests of auditory processes must follow and makes up the behavioral test battery of this evaluation. This consists of testing dichotic listening, temporal processing, monaural low redundancy speech tests, localization, lateralization, and bi-aural interaction. In order to diagnose auditory processing disorder, the individual must obtain performance deficits in the order of at least 2 standard deviations below the mean on 2 or more tests in the battery, as stated by the American Speech-Language Hearing Association. Also stated by ASHA are testing principles that one should adopt when evaluating APD. Some include making sure the audiologist is clinically competent to administer the exams, that the exams are reliable and valid, and that the audiologist must remain sensitive toward the individual's attributes. Audiograms are obtained during any hearing evaluation. For auditory processing disorder, the audiogram presents with normal hearing, although the patient may appear to have a hearing loss. It is important to note that this disorder pertains more to the processing of auditory stimuli and less to the hearing itself. As mentioned earlier in this presentation, auditory processing disorder can accompany other disorders such as dyslexia. Dyslexia, however, revolves more around the defective development of the phonetic skills necessary to identify and properly use the constituent sounds of written words. Auditory processing disorders is more involved in one's inability to accurately perceive auditory stimuli. In terms of medication, there's no said medicine to treat APD. However, there are various forms of therapies that can be used to help individuals with this hearing disorder. Individuals with APD can meet with speech language pathologists to receive speech therapy and improve their sound discrimination abilities. They can also receive auditory training therapy, which works on listening comprehension. Additionally, educational strategies can be implemented in schools for children who have APD. These can include interventions that help children learn the sounds and letters of their language. In summary, there are many ways an individual with APD can receive services. That completes this presentation on an auditory processing disorder. Thank you for listening.